this article began actually from a presentation that I gave at the American Medical Association, sharing what we had learned from the AMA Caregivers Coping with COVID survey and how we were using the findings after implementing that survey with clinicians at Mass General. My name is Dr. Carrie Palomera, and I'm a primary care physician at Massachusetts General Hospital, where I direct our Center for Physician Wellbeing. I'm here to share with you about an article written by myself and Dr. Christine Sinsky from the American Medical Association, which will be featured in the January 2022 issue of Mayo Clinic Proceedings, entitled 4 Key Questions Leaders Can Ask to Support Clinicians During the COVID-19 Pandemic Recovery Phase. And what we tried to do was really think about how can we share with others the ways that we have created opportunities for clinicians to share with leaders and to share with the organization what's on their mind, what is driving their stress, what is fueling their burnout, and what does it look like to feel valued and appreciated. For so many people, they were going through their days just trying to get by, to survive. We had lost hope and creativity, and we wanted to connect with people and learn what that looked like. But we realized we had to get creative in terms of how we could reach people and hear from them. Because initially, if we just went up to people and said, hey, how are you doing? What do you need? How can I help? That wasn't enough. They almost got a little bit angry, like, do I have to fix this too? And so we took a step back and thought about what we knew about organizational psychology, positive psychology, coaching, and other well-being tools that have been developed over the years, and said, how can we approach people in a way that gets at the heart of it? Because Dr. Sinsky's research through the AMA shows us that stress and that burnout are definitely linked with how valued one feels by their organization. The more valued you feel, the lower your stress. It's protective. And so if we could use value as the center of everything we're looking for, if we can help an employee feel good about the work that they are doing that day, if we can help physicians feel appreciated throughout their day, then we can lower stress, we can lower burnout, and we can start to reconnect with hope and creativity. And what we recognize is that we really had to get at the heart of this issue of loss, and that many of us had experienced losses, great and small, as a result of the pandemic. Many people had experienced cumulative, almost daily losses of opportunities, experience, relationships, roles, safety, security, your value system no longer matching with those around you. These were all losses, but very few people had actually stopped to appreciate that. And so when we gave people this space to grieve and to acknowledge and connect with their losses, what we then tried to do is say, there, it's out. We heard it. We hear all the ways that you are struggling. Now tell us, what does it look like to feel valued and appreciated at work? What does it look like to do a job that you feel proud of? And ask people to really just think about, without any limitations, what that looks and feels like. And then thinking about, if that's really where we're going, if that's our goal, then what's getting in our way right now? Where are we? And how could we do better? And then with all that in mind, what do you want us to do? What is your ask of us as leaders, as an organization, to move forward? How can we help you do a job that feels good, that you can feel proud of, that you can deliver the care that you set out to, that gives you meaning and value and purpose? And through these questions, we were able to reconnect with that creativity. We were able to reinstill some hope, find real concrete solutions that were small early wins, long, bigger term issues that needed to be managed. But we had a place to start that was truly connected to what mattered to people. And so from there, we summarize these, we give you tips about how to ask these questions, the right environments to create, to be able to hear these answers from people in all types of environments, and then potential next steps and how you can use them. I invite you all to check out this article in January 2022, and I look forward to hearing from you.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.